And you can take it away.
Thank you. Bismillahirrahmanirrahim. I begin in the name of God, the All-Merciful and the Compassionate. I want to thank everybody for joining us tonight. We are incredibly fortunate to have Michael Skaggs and Wendy Cage join us from the Chaplaincy Innovation Lab. And the goal of tonight's webinar is really to better connect the membership of the Association of Muslim Chaplains with the work that is being done. We are proud to be a partner with the Chaplaincy Innovation Lab and really would like to see our chaplains benefiting from many of the incredible programs that they are offering. So they've been gracious enough to share their time tonight to provide some more information about what that is and how you can all benefit from it. Just let me, shift my screen here so that I can read your bios. Wendy Cage is a professor of sociology and women's gender and sexuality studies at Brandeis University. She is an expert in contemporary American religion, especially related to religion in public institutions, religious diversity, religion and immigration, and the religious and moral aspects in healthcare. Among her publications is Paging God, Religion in the Halls of Medicine, which explores how doctors, nurses, and hospitals address religion and spirituality. She has garnered $5 million in funding, including from the John Templeton Foundation and the Henry Luce Foundation, to support her work and that of her colleagues. And you can find out more on her website, which you can link to from the Chaplaincy Innovation Lab. And Dr. Michael Skaggs is Communication Director of Transforming Chaplaincy Project and Project Manager in the Department of Sociology at Brandeis University. He's a historian of American religion with particular interest in interfaith dialogue and has served in innovative theological education programs. His work has appeared in Sociology of Religion, International Journal of Maritime History, U.S. Catholic Historian, Books and Culture, Maritime Executive, and elsewhere. With Wendy Cage and Jason Zudenreich, he is completing a Louisville Institute-funded project on relation between seaport chaplains and land-based religious congregations. So with that, I will pass it over to the two of you. Thank you so very much for blessing us with your time tonight.
Absolutely, and thank you for the invitation. It's always great to just talk about the work of the lab and how we can be a resource to various individuals, organizations, or whatever the case may be. You know, one of the things that we pride ourselves on in the lab is that we can serve as a resource in whatever way it makes sense and is helpful to individuals. So we will get feedback for requests on webinars on a certain topic, or someone is interested in doing a research project, but they don't know how to get started, or they don't have a partner to do it with, or they need some guidance on the literature in a certain field. And so we're very responsive in that way, and we point people in the direction that we can. The capacity question falls on basically myself, Wendy, and a couple of other people who donate their time very generously. So we can't be all things to all people, but we do try to be something to everybody. And I think that in that regard, we succeed very well. Wendy, do you want to say a little bit more about sort of where the lab falls in this moment in American religion?
Sure. So the lab launched just a year ago in October, and Michael and I and a number of our colleagues have been working on a lot of different projects about chaplaincy and spiritual care. And what we know as sociologists, as historians, is that American religious life is really changing. Fewer people are belonging to congregations. Growing numbers of people, especially young people, are not affiliated with religious organizations. And we began to wonder if chaplains and spiritual caregivers were doing some of the work that in the past was done by local clergy across religious traditions. We don't know the answer to that, but we were curious. And so we sort of launched the lab to begin to understand what religious leadership looks like in this demographic profile, in this demographic reality, who is doing the work of chaplaincy and spiritual care. We like to say we spark practical innovations. So we're a think tank in the sense that we're researchers, but we care a lot about what's happening on the ground. And we want to try to improve the quality and supply of chaplaincy and spiritual care. And we are seeing chaplains in many places we didn't used to see them, in New York public transport, in veterinary hospitals. It's not just the military and healthcare and prisons where chaplains have always been. Here in Boston, there are several chaplains that work with homeless organizations. So we're sort of asking big questions about where in today's religious reality are people finding, creating, getting meaning and spiritual support, and how might chaplains meet those needs in the places where people are as they are, recognizing that that's often outside of congregations. So we called this the lab intentionally, with the idea that a lab is a place that we sort of come together and try on ideas, try out approaches, try out different ways of sparking practical innovation. So one of the projects that we're helping with right now is here in Boston at Hebrew Senior Life. They have trained medical assistants who visit elders who are still in their homes, many of them isolated, how to do a basic spiritual assessment. And then if it seems that an elder would benefit from a visit from a chaplain, they can call the chaplain in. So we're constantly thinking in creative, new, different ways about how to bring the spiritual care providers and the chaplains to where the need is, and how to collaborate with other people in that process.
You know, and one of the things that we do, it sounds paradoxical, but it makes sense if you think about it. One of the ways that we innovate is to step back and ask really simple questions about the field and the profession and see where the answers lead us. We did a survey at a small liberal arts campus in New England about university chaplaincy that basically asked a large portion of the students. We got a great response. You know, what does chaplaincy mean to you? Have you gone to see the chaplain? Have you participated in events sponsored by the Office of Religious Life? What does your faith practice look like? These sorts of really basic questions to ask a student. But when you look at the answers, that tells you a lot about how that particular demographic views chaplains, some of which make sense and others are counterintuitive and you would not expect. In a lot of ways, chaplaincy for a very long time was a field that went sort of unexamined because its value was sort of considered to be obvious, or chaplains had always been around, so there's no reason to really think about it because they're always going to be there. But as religious demographics change, and as the places that chaplains are showing up and doing their work change, we really have to think a little bit harder about this and try to figure out how can we support chaplains that are doing this really good work in new places. Most people would not expect to see a chaplain in the MTA in New York, like Wendy mentioned, or at a casino, or at a racetrack, or wherever. But chaplains are in all of these places. If we don't start to ask some really simple questions about what that work is, then we're not going to be able to help make it be more effective and responsive to what people actually need. Jay, give me a little bit of an idea of where AMC chaplains find themselves. What is kind of the breakdown of where those chaplains are working?
Yeah, so we are predominantly in the primary institutions of chaplaincy. So healthcare, military, education, and corrections are sort of the primary demographics. There's a significant number of corrections chaplains at the state level who we are not yet connected with, or who have not found their way to us yet. Within the military and the federal level, I think there's, somebody maybe has exact numbers, but I think there's only about 15 Muslim chaplains in each of those settings right now. So we've got a portion of them who are connected with us. Healthcare and education are really the primary areas. So the last time we did a count of education chaplains, I think there were about, gosh, it's been a while, 65 or so working in education. And I think we now have about 45 healthcare chaplains who are members of AMC. So, and it's a growing movement. What we are seeing, though, is a lot of the positions for Muslim chaplains, particularly in campus setting, are part-time.
Yeah.
So one of the things that we've thought a lot about is sort of how chaplains are trained, where the positions are, how they're changing and evolving. This part-time piece is, I think, very common. And we recently finished a study looking at theological schools, rabbinical schools, and which of them have training specifically in chaplaincy. And part of what's interesting is we think that about a quarter of theological schools in the US have some sort of chaplaincy track or chaplaincy degree. Some of them are MDivs, some of them are MAs. We intentionally oversampled the Muslim programs, the Buddhist programs. There are no Hindu programs that we're aware of. But it was interesting for us to see where the Muslim programs are emerging and then what the placements are for the graduates from those programs. And we worry sometimes that we spend too much time focusing on supply, right? I mean, how chaplains can best be trained, where they can do their work. These are really good and important questions that we need to work through. we've tried to focus as much on demand, right? I mean, where there's a need, and then figuring out how to bridge the supply and the demand, because particularly as some of these theological schools are retooling programs, trying to figure out how to build programs. I mean, what we learned, we found about 80 such programs, and every single one was created by itself. So they don't share any common curriculum. If they're MDivs or MA programs, they have to adhere to a broad set of standards, but we don't really have agreement within chaplaincy as a field generally, or by particular religious or spiritual group, what the basic sort of skills and competencies are that chaplains need. And so part of what we're continuing to think about is how to have that conversation and figure out empirically the answers to those questions. And when it makes sense to think about chaplains by sector, right? When it's healthcare chaplains or military or prison, and when we really need to be building relationships across the sectors or the silos where chaplains are working. And so really the data is just beginning to emerge about where those places are, how people are trained, when they're trained in particular programs, when they've put together training in lots of other ways, when they don't have any training at all and the institutions aren't interested in that. And so we don't have as many answers as we have questions. And we would also really love to hear from you and your colleagues about how the lab could be helpful. I could share the website if it would be useful. We've tried to list programs, lots of bibliography, a lot of audio visual material that people might want to use in classrooms or, in other settings, but we're not doing our job if we're not meeting the needs of chaplains out there. So any suggestions that any of you have in this context or in others, please know that we're all ears and eager to collaborate and be a support in any way we can.
Jay, it occurs to me that if I think about programs that provide training in Muslim chaplaincy, only two come to mind immediately. That's Hartford and Bayonne Claremont. For Muslim chaplains who are going through non-specifically Muslim programs, what needs are not being met in that situation?
That's an interesting question. And there are a couple of other programs now that are on track towards accreditation. So there's the Islamic Seminary of America in Texas and the American Islamic College in Chicago. And CTS just launched a partnership with Bayonne as well for a program in Chicago. And then the Boston Islamic Seminary. And then Howard has an interfaith chaplaincy program with a focus on Islamic. There's like a Muslim chaplaincy tract. And Union Theological Seminary also just launched a Muslim chaplaincy training program. So your question of demand and where these people will get jobs is certainly one that I spend a lot of time thinking about. And what are the skill sets that institutions are looking for, and the skill sets that Muslims are looking for, which may not always be the same. Yeah.
The question of that matching is a tough one.
Yeah.
There was a comment in the box that says only really wealthy schools can afford full-time Muslim chaplains, and that comes as no surprise to me. Chaplains of any stripe cost a lot of money that a lot of schools are tempted to say, well, we can save some by not funding these positions. I'm just wondering, for those schools that do have Muslim chaplains, whether they're part-time or full-time, do they typically work for the school, or are they employed by some other or funded by some other organization local, but they provide service for those students?
Yeah, so there are a couple of different models that are springing up right now. Some of the smaller liberal arts schools are providing direct chaplaincy. And I think it goes from shifting, do we see the Muslim chaplain as only being there for the Muslim, or do we understand how they relate to the larger campus picture? So we have Sharif Rosenan, and he and Bilal Ansari, I think, have done some really great work at Williams College, where they've helped to really sort of strongly root the Muslim chaplain in the larger chaplaincy of the campus, to provide services for not just Muslims and be present in a multitude of ways. We have other schools such as the Felicity Foundation at the University of Michigan, or the Hadi Institute or Initiative, through UVA, or the Chaplaincy at Rutgers, where it's a nonprofit organization that's funded in part by Muslim alumni who are providing, and that happens. For those who aren't familiar on the line, when we have a state school is not allowed to hire chaplains. And so these organizations pop up to support, trying to sort of replicate a model similar to Hillel, how they would operate, but with Muslims specifically. One of the questions earlier was sort of for those who don't go through the chaplaincy training programs that are specific, what are the things that they need. And campus chaplaincy is one of the areas where sometimes we see people coming in with different backgrounds. And there, I think one of the challenges that people have is they may have beautiful traditional Islamic sciences, but they may not have the fluency in interfaith work or working with a Christian student, how to help that student tap into their own resources.
Right, right. When I think about what the lab can offer Muslim chaplains in specific, but also all chaplains in general, we try to strike a little bit of a balance between content that is specific to certain groups and things that can be taken advantage of to some degree by everybody. I'm thinking of just the other day, we had a nice little report from Lance Laird, who is at Boston University, on a project on mapping Muslim chaplaincy and some of the challenges that the chaplains he spoke with face in the workplace. Obviously, that is very specific to one particular community and has a lot to offer there. But everything else that we provide, I'm thinking specifically of all the webinars that we do that are open to anybody. They are on a wide variety of subjects, and sometimes they are deep dives into one thing, and other times they're much more broad conversations. But one thing that we always try to make sure those webinars accomplish is that everybody can take something away from it. You know, it might not change their practice overnight. It may not change their career totally, but they can walk away and do something with what is there. So I would certainly encourage AMC members to check that out. Anybody can register, anybody can come. They don't cost anything, so it's just a great resource to take advantage of.
Thank you for those.
And Wendy just dropped Lance's post here in the chat box, so please do check that out.
Yeah, and I'm seeing a note here from Mohamedou who mentions that he went to Harvard Divinity School, and he didn't read a single hadith. So the hadith are the traditions and sayings of the Prophet, which really inform Muslim practice and approach to things. And so that, I think he wouldn't be the only one who would speak to going through a chaplaincy training program, but not having the connections to our own tradition to draw from.
Well, this is one of the challenges I think many non-Christian groups face. It's a problem, right? Which is that the word, the concept, the training has such a strong Christian history. And I think we are trying as best we can to certainly be aware of that and deconstruct that. But it remains an issue. So I wanted to hear more about kind of when you said what people are looking for when they hire, and then what individuals are prepared to do, or how to bridge that gap. We have a project with Shelley Rambo at Boston University that some of your members are a part of now, really trying to get the educators to think about what the employers need. And it's tricky because as far as we can tell, those groups are actually not in any sustained conversation. And so the education isn't always informed, sorry, it's late, by the demand. So it's trying to get a sense of what that would look like.
One of the interesting areas I see in the American Muslim community is this tension sort of between the vision of the chaplain as the scholar, the Muslim scholar who is deeply entrenched in their Islamic knowledge and practice, and the clinician. And depending on which program you look at, you'll oftentimes sort of see it swinging in one direction or the other direction, or this sort of very middle ground, like interfaith, everything is all good together on the far end of the extreme. And I think that there's a tension. A lot of the Muslim community doesn't necessarily understand what it is they're seeking in a chaplain. And so when a university has their students involved in that conversation, there's not always clarity in that. Or when a program is starting curriculum, there's finding that balance between those different realms. And then also recognizing that like what a corrections chaplain needs will be different than what a hospital chaplain will need in terms of their fluency and yes, as you said, Wendy, it is late within those spaces.
We've dreamed about supporting, I mean, obviously we'll support programs that are looking for assistance, but we've dreamed a bit about programs where there's a basic chaplaincy curriculum, you know, like what are the things that all chaplains need to know regardless of who they are and where they work? And then you can specialize. We need to specialize for exactly the reason you said. What you need in the military is not necessarily what you need in federal prisons or on college campuses. Even the programs, the theological schools that are creating chaplaincy programs, there's still not very many classes. So, you know, there's just not a lot of curriculum out there. We've tried to put some syllabi and the materials we can off those syllabi up on our website, But this is one of the few growth areas, we think, in this kind of education, and we hope that people will continue to build out the training that we think is required to do the work well.
Well, and that balance between sort of general training and specific training is so interesting because clearly the skill set of one is not the same in every sector. But to bring back the project that Wendy mentioned that some of your members are part of, Bilal and others, we brought all these people together in Boston over the summer. They're all working or educating in really different contexts. But when they all sat in the same room for a long time and we gave them some things to talk about, the sparks just flew. And it made total sense that they were all talking together. You know, it might not seem intuitive that a corrections chaplain and a hospital chaplain have a lot to talk about. But if you kind of push them together and say, no, talk about this work, it turns out that some commonalities come out and there's a lot to be learned. There's a lot to be learned from both. At the same time, you know, you certainly don't want to flatten out every tradition or philosophy to be the same. But as we mentioned, the Christian historical conditioning of chaplaincy means that every non-Christian tradition has something in common with all the others, and that they're working within a system as a minority. We're going to have an interview that goes up on the website in a couple of days from the Hindu chaplain at Yale. Hindu chaplaincy is absolutely in its infancy. And of course, Hindu and Islam are completely different schools of thought, but there is a lot to be gained by looking at, okay, what does it look like for an organization to try to get off the ground when so much of this environment is predicated on a very clear and fairly narrow theological history that is just not shared by a growing number of chaplains. So I would certainly encourage cooperation along those lines, because it's just, it's going to be more efficient.
So Jay, can I ask what you or anyone else on the call, I mean, what kinds of needs or challenges do you face that we might be able to be of support around? I mean, probably we can't do it today, but it would be great to make a list. I mean, we provide research consultation, we provide ongoing education, we do a lot of networking and convening of different groups. We're trying hard to get the educators to think about what's required in hiring. We're thinking about starting a job board just because we're aware that job postings are all over the place. You know, what can we do? How can we be of support?
You know, we don't have that many attendees. I wonder if there's maybe room to include others. And I should say, for those of you who are joining, Chaplain Shamsia is sick tonight, which is why she's here in spirit and in sound with us, but not joining in the facilitation part of the conversation. So prayers that she may have quick healing. But I would love to hear what others have to think here about the question that Wendy's brought up.
Well, and we discussed prior that this is recorded, so anyone that is watching this later, please contact us. You know, none of what we do makes any sense unless it's responding to an actual need, so please tell us. I mean, just Jay, and for you, what would be helpful for you?
Well, I mentioned this when we spoke on the phone earlier. I am really excited about the webinars that you all have been putting together. The webinars is in theory is a big part of what AMC looks to provide, and it's something we've struggled with. And so to see what you guys are doing, it's beautiful. Like, I look at those and I'm like, well, we don't really need to be doing this in some way. No, I think we do, because we need to bring it back to the Islamic connection for people to dive deeper into. But that you're covering things like trauma chaplaincy is really valuable. So I hope that people will benefit from those.
Yeah, and if there are people that would be interesting to talk with or particular topics, let us know. We're happy to think about anything.
Yeah, we're also happy to co-sponsor and make our technology accessible, if that would make your lives easier.
Thank you. We are fortunate. Band Claremont has just last month offered to do that for us.
Okay.
There's a question here from Chaplain Shamsia. Does CIL provide specific assistance in any particular area of work?
I think we're pretty broad. I mean, right now we're doing the continuing education through webinars. We've got about 6 or 8 research projects going. So we're constantly writing grants, all of which are collaborations with different people and institutions. We're trying to find a way to embed chaplains in primary care practices. We're trying to find a way to pilot a program through which chaplains of color are embedded in student groups, because the study that Michael mentioned showed us that people of color, students of color, were less likely to approach chaplains. Religious minorities were more likely to approach chaplains. And so we're trying to think of some more creative, out-of-the-box ways to support all students on university campuses, but particularly students of color in this climate. So we're working on that. We are working on a project right now, training spiritual generalists. So this is the idea that in healthcare, but you could actually make the case in any institution, that anyone should be able to sort of do a very basic spiritual assessment, or sort of know how to see if someone would benefit from the services of a chaplain and should know how to find a chaplain. So we're working on that project to turn it into a sort of hybrid online training program that would be very widely accessible. So we do a lot of research-based education. We do a lot of research projects. We do a lot of continuing education based on the research. And then a lot of networking and convening and trying to support people where they are. I see the comment about job descriptions. I'm not sure. So I don't know enough. Michael and I have been talking about doing a project where we assess both how expensive it is to be trained to be a chaplain, to try to do the cost benefit analysis, not because we want to encourage anyone not to become a chaplain, but because we're trying to look at the low salaries, part-time work, et cetera, and the cost of going into some of these degree programs. We haven't done an analysis of job descriptions, but we've been trying to find, if any of you know a labor economist, we've been trying to partner or find a labor economist to partner with, because we think we can scrape the job descriptions off of LinkedIn and other places the jobs are posted, and then actually begin to synthesize where the jobs are, what they're looking for, and how they've changed over time. We are certainly, I see the question about endorsing. We're really happy to talk with you about what that would look like. We don't know how to do it. I don't know how to do it, but we have relationships with people who do. And we'd be happy to link you to some of those people.
Yeah, I think that as sort of fuzzy and amorphous as it sounds, networking is where the lab really shines, because we've been so fortunate to meet so many people just in the past year that we've existed, that not a day goes by that I don't get a referral from somebody about something, or send somebody's way. So as these things come up, please just let us know. And, we may not know the answer, but we probably know someone who does.
Yeah. Grant funding. We're on the lookout for grant funding that would allow us to hire an administrator.
It's really hard to find operational funding. I mean, you know this.
Yeah.
We have a long list of funders that I'm happy to share with you offline. I think you probably know that some of the main healthcare chaplaincy organizations are close to forming a merged organization, and they actually intend for that new organization to not be healthcare focused, but to be chaplaincy focused in general. And they are eager to partner with smaller groups who don't have the kind of administrative support that some of them do, and create a way to support those groups. So I hope that you're already in conversation with this group, but if you're not, it would be great if we could make that link. We have helped to make the link for the Hindu chaplains. I don't know that it'll work or that it's the right thing for you, but it's really clear that there are a lot of smaller groups that could benefit not from the knowledge, but just from the institutional resources that some of these larger groups have. And I think it's their ethical obligation to provide them, and they're going to be in a position to do that. So it might be easier than grant funding, because if it's based on membership, you don't have to keep writing grants. It might renew.
We're not involved in that conversation, and we would love to be.
So I'll follow up with you afterwards.
Thank you.
Yep.
We've got a question from Nora here that looks like Michael's already responded to, wanting to know about how to deal with a student accused of sexual assault who's part of a community program that she's with on campus.
Yeah, happy to make a connection there, but we're certainly not positioned to make any recommendations on that.
Where do you see the future for the Chaplaincy Innovation Lab going? What's that look like for you?
So I want to ask the question first: what do we think the future of chaplaincy is in the United States and abroad? Because I think we have to have some guess at the answer to that before we can figure out how the lab can be of use. My hypothesis is that the opportunities and positions for chaplains will continue to grow as local clergy continue to shrink. We did what we think is the first national study in March of 2019, asking a representative sample of the US population if they had had contact with a chaplain in the last 2 years, and 20% of people said yes. And half of that contact was in healthcare. So my hypothesis is that chaplains will continue and expand their roles as sort of spiritual first responders, and they may be the only person that someone meets with formal religious education, be it in the military or prison or with the Red Cross, which now has a chaplain on every disaster team. So if our hypothesis that chaplaincy will continue to sort of grow and sort of spread out is accurate, we really want to just find ways to be of support to those chaplains. I think many chaplains are supported by religious organizations. And so it's not that this is an either or, it's a both and. And I mean, Michael and I have more work than we could possibly do now. So we are also looking for funding to try to run more programs, provide more content resources, longer continuing ed modules. We hear a lot about self-care and the real need that chaplains have for self-care, and neither of us know how to do that work, but we would love to partner with a group who does. So I think we want to keep providing resources, and I want to keep asking big picture questions. I mean, we're asking big picture questions, particularly of the federal government right now, and how they staff chaplains, if their model is the model of the future or the model of the past, and what it would take to perhaps shift that model in a way that matches today's religious demographics. So I'm sort of like a mosquito. I can be really annoying. So I just keep asking these really annoying questions and hoping that with time, we can make some change.
You know, and I think in a lot of ways, groups like the AMC are going to be really important to this conversation, because if we look at those religious demographics, one way to read them is to say, okay, all of these traditional historic indicators of religiosity affiliation are on the decline. You can read it one way and say, well, then religion must be receding. Well, but populations like Muslim populations are growing in the United States. That's not a story of religious decline at all. And it's not, you know, just restricted to Islam. So the degree to which members of the AMC and other leaders can be sort of part of that conversation publicly, that's going to nuance the conversation in a way that's not really happening right now. I mean, we're just sort of fighting against the idea that religion was going to disappear, right? The secularization thesis, it's all just going to fade away as people become more modern. But what we're seeing is that religion is just changing how it looks. It's not going anywhere. It just doesn't necessarily go by the same labels as it has for the past, you know, century or so.
So I see another question here in the chat about what we see from our research and experience about how non-Muslim faith communities are experiencing challenges bridging the gap between community clergy and chaplains, as in your experience between imams and chaplains. I think we see that in two ways. We see it in one way. So I'm writing a book about chaplains in Boston, and I went on a hunt to find any chaplain in an organization, any organization in Boston, and I interviewed the individual. And some of them are full-time chaplains, but many of them are community clergy also. So in one way we see it is when it's a single person who's trying to serve both as a chaplain and as a community clergy member, and putting those hats on and off, and the kinds of challenges that are faced there. I'm thinking about the Boston Police Department has chaplains. They're all local clergy, all but one, I think. And so they end up in really tricky positions where they are sometimes called to help mitigate disputes, but they belong to one of the communities who's in the dispute. And so it's very complicated, tricky, trying to sort of tiptoe through some of those issues. That's one way we see it. The other way we see it, which I think is what this question is about, is when chaplains are called to sort of help bridge individuals with local religious resources, with imams or local clergy. We certainly see that in hospitals. And again, I don't have any sort of wisdom to offer, just that I think that it happens in a number of different settings. I'm thinking also of a number of prison chaplains I interviewed who talk about how the requirements do not allow them to stay in touch with people that they have provided support for while those individuals are in prison. But in some cases, those individuals return home and they live in their neighborhoods. And so they become the local clergy person, or there's a reach out there. So there's a lot of identity work. I'm not sure if I'm answering the question, but those are some of the thoughts that the question is leading me to.
Yeah, and I can add in a little bit to his question, because it's a conversation we've been having, particularly among our healthcare chaplains. Is sort of, there are these skill sets of chaplaincy that we see that would be beneficial for our imams to have, and so looking at ways to bring some of our skill sets to them, and looking for models that maybe exist where chaplains have provided support or training or resources for their clergy members back in their communities.
So there are some hospitals, University of Pennsylvania Hospital used to have a program, they may still, where they kind of ran training programs for local clergy, trying to impart some of those skill sets. I can think of a couple of other examples, usually with grant funding, usually from Lilly, in which there were basically the kinds of educational programs that you're describing. That's fundable. I mean, that's something that we might be able to collaborate on a grant to fund, because it would be great if you could do the trainings in person, but you could also do a series of webinars, right? That could be available for imams, and you all have the knowledge of, what those skill sets are and how to teach them. I think that's a great idea. And I'd be happy to talk, we'd be happy to talk further about how to, maybe where to look for funds for that one.
Great. What other questions do you all have, or thoughts about what would be helpful in terms of resources for you in your own chaplaincy? I would also be curious to know if any folks that are on the call right now have benefited from some of the Chaplaincy Innovation Labs programs, if you watched the webinars or other things. Self-care. Yeah.
Yeah, self-care.
Yeah. What are some, in your own work with chaplains, what are some of the sort of exemplars of self-care that you've seen?
We hear about self-care so much that we just wish we had the answers. So I'm not sure that we have the exemplars yet, but we've just started to think about who we know or who we could partner with to figure out how to provide it. So I would say that that is in our incubator. It's something we want to try to figure out, but we don't have the answers yet. We just hear such a need for it. Yeah. I see a question about whether we could review your website and identify gaps. Yes, we'd be happy to do that. Just somebody follow up with this.
So many.
Yeah, just send us an email. We can also, I mean, I don't know how you do your administrative work, but we could see if there's a student maybe at Brandeis that could help you if you have a little bit of money or something like that.
That would be amazing.
Yeah, so let us know.
We don't do administrative work right now, aside from late hours of the night when my children are
I hear you. Mine are too. I hear you.
Yeah. Great question here, or request for group spiritual psychotherapy for mental health patients and people with addiction. That would really be a blessing to have. Susanna raised that one.
There is a webinar if you go back through it on our website. And what is the title of it? I think it is called Chaplaincy for People in Transition. And one of the guests was a chaplain in a mental health facility dealing with a wide range of patients. He would be a good resource for that, for the person asking this question, because he deals with a lot of these issues.
Yeah. And then a comment from Nora that she loves the webinars, especially appreciating the wide variety of topics, including the last one on ethics of justice.
Well, thank you, Nora.
So I'm going to follow up, Jay, and put you in touch with the people working on the merged organization. If somebody sends us an email, we'd be happy to review your website and see how we could be of support there. We're going to continue to try to think about how to put together modules on self-care. We can connect you to endorsing, think about the endorsing process if that would be useful. Otherwise, Michael and I are both on email pretty much all the time. So please feel free to be in touch with us. If you want to co-sponsor webinars, really anything. We're really eager to partner and work alongside you.
Thank you. I've got one more question here.
Yeah.
I know that the two of you are probably the best read in chaplaincy in the country. And I am wondering if you could sort of identify some of the core books for those coming into chaplaincy to read.
You should read Wendy Cage's book called...
I have, in fact, it's used in Dr. Lucinda Mosier's class at Hartford Seminary on chaplaincy models and methods. It was phenomenally helpful. Thank you.
I would read Winnie Sullivan's book. It depends. If you want sort of practical how-to guides, that's different than if you want to sort of understand the big contextual issues. I think Winnie Sullivan's book, A Ministry of Presence, is the best sort of overview look at the history and legal issues that surround chaplaincy, and is really helpful to understanding how and why chaplaincy has come to be in the position that it is. You probably won't learn much in that book that would help you in your day-to-day practice, maybe, but it's a sort of broader piece that I think is really useful. What else? I like Kim Hansen's book about diversity in the military, chaplains and diversity in the military. Ronit Stahl has an excellent book that looks at the history of chaplaincy in the military. It came out, I think, 2 years ago. She's a historian at Berkeley. That's a terrific book. In the UK, they recently published a handbook of chaplaincy. It's very British, and so I don't know how helpful it would be to chaplains here, but they have chapters for almost every sector where chaplaincy takes place. So it's interesting just for comparative purposes. George Fitchett did a reader for anybody who's in healthcare chaplaincy and interested in the evidence base that supports your research. He did a reader about 2 or 3 years ago with Kelsey White and Kathy Lines, which I think is some of the best evidence base for the work of healthcare chaplains. So I think that that's really useful.
And just, I'll follow up to say that because the lab has relationships with so many different people and a couple of projects we're involved with, if you just keep up with the lab, sign up for the newsletter, that sort of thing, there are, you know, half a dozen projects in the works that I know of that are going to be coming out in the next 2 or 3 years that are going to have a wide audience. So just if you keep in touch with the lab, there are things on the way.
Josh Dubler's book, which is called Down in the Chapel, is a really nice look at chaplaincy in prison. It's an ethnography. I'm not in my office, but I have a shelf in my office of first-person accounts of chaplains, which I just enjoy reading. I like Kate Browserup's book, Here When You Need Me. She's a chaplain with the Maine Warden Service. I enjoy her writing. I'm trying to think of other first-person accounts. There's an older book called Blessed with Enough Foolishness, and it's a kind of first-person sort of ethnographic account of a healthcare chaplain being trained. I'm not sure it's in print anymore, but it's an interesting read. That's probably way too many, sorry.
Oh, that's wonderful. There's a group among the healthcare cohorts that are planning a book group. So we're wondering what's out there that we should.
There's your material for the next year.
So I would encourage you to read about current issues in healthcare. I mean, just to the extent that, I don't know, I feel like we're doing our best work when we're able to figure out where the institutions are. And we're in the middle of a project right now where we're interviewing healthcare executives in 3 cities about how they think about chaplaincy and spiritual care. And we're interviewing chaplains who work in those same systems to understand the work they do. And one of the things that's, you know, quickly becoming clear is that the executives and the people who make the decisions about our jobs and budgets don't necessarily know all that much about our work. But when we can talk to them in the language that they use, which is about problems and solutions in their organizational work rather than in ours, we make more progress. So there's a terrific example of a hospital that it's a big public system in the South that was having a lot of problems with wait times in the emergency room and people getting very agitated, all kinds of conflicts. And they have a very, charismatic chaplain who figured out a way to fund several staff positions in the emergency room. This is a very large hospital and a very large emergency room. And I'm not going to say that the problem went away, but he was able to address an organizational problem. When you address organizational problems, you get resources. So to the extent that anyone's interested, I would just encourage you to think carefully about what the organizational problems are that your supervisors have and what we have in our toolkit, you, not me, I'm not a chaplain, what you have in your toolkit that can help to address those organizational problems. And it puts a lot of onus on us because we have to be constantly code switching between the work that we do and the work of our supervisors, but I think it sometimes helps us make progress.
Sharif is asking the title of the George Fitchett. Is it just evidence-based spiritual care or evidence-based healthcare chaplaincy?
I'll just find it and put it in. Hold on.
I also see one from Shamsia as well. Did you get it already?
What do we suggest for Muslim chaplaincy to grow?
Okay, wait, one thing at a time. Here's George's book. What's the best book on the current issues in healthcare chaplaincy? I don't know. I mean, George's is a lot of different topics. My book is old now, but it's looking more holistically, but it's not current. I mean, it was published a long time ago. I have to think about that. how to help Muslim chaplaincy grow. My question is, where's the demand? So where is there a need for Muslim chaplains that Muslim chaplains are not, because they're not resourced, because they don't have access? Where is there a problem or a challenge that Muslim chaplains are uniquely skilled to be able to address? And then how do we shine a light on that place and those opportunities and pilot something to see if we can help make a difference?
Yeah, it really, for any sort of type of chaplaincy to grow, it has to be responding to an existing need. And that's where we've seen some of the most interesting things pop up. I'm thinking of the bicycle chaplain in Boston. Nobody ever would have gone out to become a bicycle chaplain on their own. But because the executive director of the Massachusetts Council of Churches happens to be active in that community, when cyclists started dying in traffic accidents, they turned to her and said, "You need to be the chaplain." She responded to a real need. So just to echo Wendy, wherever there is an actual need now, that is where the growth is going to happen. It can't just come because chaplains are interested in X, Y, or Z. It has to be a real need.
I'm curious to know, I mentioned earlier where the bulk of Muslim chaplains are, I neglected to mention our community chaplains, we have a few in police chaplaincy, in particular, and then others that are working with various different community organizations. The way that AMC defines a community chaplain for the purposes of membership are either a chaplain who is professionally clinically trained in chaplaincy, who's working with an organization but who may not be specifically recognized, or somebody who is institutionally recognized. So showing up at the mosque and sort of presenting oneself as the chaplain without being recognized by the institution or having appropriate training does not constitute chaplaincy. It's different and it's important and it's valuable, but it's not quite the same thing. But there is a sort of slowly growing area that is mosque-based chaplaincy. So ISBC in Boston, with Sharita, who you both know, a little bit there, and then most sort of notably, I think the Adams Center in Herndon, Virginia, which has a chaplain, trained chaplain on their staff. And I think we're starting to see other ones grow. And it makes me curious, do other faith communities have chaplains in their houses of worship?
They're growing there also. So there are a few synagogues that have chaplains affiliated. One of the fastest growing groups of community chaplains are those trained through the International Federation of Chaplains, which is a Christian organization that provides very short training and credentials people in a way that most of you who are sort of professionally trained wouldn't recognize. But there are quite a few community chaplains who are credentialed through the International Federation of Chaplains affiliated with Christian congregations. So yes, we see this growing. Mark Shaves, who's a sociologist at Duke, has run the National Congregation Study for many years. It's a longitudinal study. And because I was like that mosquito in his ear, for the first time in the last wave, he actually asked a question of all the congregations, which was about whether they have a chaplain on staff. He doesn't have that number ready to release. I don't know what it is, but it's more than 10%. So I don't know that he'll know how long those positions have been there. But I think that there's more of a history there than we know. And it's something to sort of sort out. So it's really interesting for me to hear you say that you see it emerging as well, because I think it's growing.
And there's an interesting gender component of it in Muslim houses of worship, because our imams are, with a handful of sort of fringe exceptions, our imams are all men. And because of the gender segregation that's commonly practiced within the mosques, it's a little bit harder for the women to sometimes have access. So we see these sort of beautiful opportunities for partnership that develop there.
The gender piece is something that we saw also in our work in theological schools amongst Muslims and Buddhists. We don't have any Hindu examples, but the credentialing of a chaplaincy degree that creates sort of a career path or track for women that wouldn't have historically been there in those settings, we think is a key piece of what these training programs are doing. So we don't have the data. We tried to get enrollment data and we tried several times and didn't succeed. But I think that's an interesting place that piece that we definitely don't want to overlook in this story.
I'd be curious also to see the gender breakdown across different institutions. We have
race.
The first female Muslim military chaplain is about to take her oath, as you may well know, later this month.
What is her name?
Oh, see, now I knew you were going to ask me that.
Sorry, I can ask you later.
Yeah, I'd be happy to send it to you. There's some beautiful information that the school put together about that. And sister, I apologize. I'm sure you're going to be watching this recording later.
On me, I should have known already.
Any other questions from folks? All right. Well, thank you both so very much. Is there anything else that you would like to share before we?
I don't think so. Thanks for having us.
We are here for what your members need and want us to do. So please be in touch. Sign up for the newsletter. Follow us on social media. That's the best way to do it. And we're happy to hear more.
Yeah, just tell us what you need.
Great. All right. Thank you.
Good night.
Really appreciate it. AMC members, please make sure that you have March 21st and 22nd saved in your calendar for the annual in-service training and members retreat that'll follow it on Sunday. That will again be at Yale University in New Haven, Connecticut. We look forward to being able to announce the programs that'll be happening soon. And keep an eye out. You will have renewal letters with an annual report coming your way shortly for those of you who need to renew your dues. Thank you all so very much.
Thank you.
Good night.
Bless and be with you. Assalamu alaikum.